Welcome to Community Health Briefs, where AI hosts share short, clear stories about research shaping healthier futures. Each episode highlights new work from members of the College for Community Health at Montclair State University, showing how ideas connect to the social and structural forces behind health. In short, this is research you can trust, explained by AI in minutes. Hello, and welcome to the first ever episode of Community Health Briefs. I'm Dr. Brad Van Eden Moorfield, Senior Fellow for Fostering Unity here at the College for Community Health, CCHL for short.
Hi, and I'm Dana Levitt, Associate Dean for Academic Affairs at CCHL. We're so excited to launch this podcast with you today.
This podcast is something a little bit different. Each week, in just about 6 minutes, we'll highlight a new piece of research from our faculty or students. The episodes are fully AI generated, but every script is reviewed and verified by the author of the research itself. So while the voices you may hear will be digital, the scholarship is real, trusted, and rooted in the lives and communities we serve.
And that's exactly what CCHL is all about. Our mission is to promote equitable health and well-being for individuals, families, and communities in New Jersey and beyond. We do this through teaching, research, and service, and most importantly, by engaging directly with the communities we serve.
That's right, Dana. Our college is home to 6 departments as well: counseling, communication sciences and disorders, kinesiology, public health, family science and human development, and nutrition and food studies. Together, they give us a multifaceted perspective on what shapes health and well-being.
Because our work is so multifaceted, it allows us to work with people holistically, not just looking at one part of health, but seeing how physical, emotional, social, and structural factors all fit together.
And a big part of that holistic approach is recognizing the role of what are called social and structural determinants of health. These are the conditions in which people are born, grow, live, work, play, and age. The factors that shape health long before someone steps into a doctor's office.
Think about where someone lives. Do they have safe housing? Is there affordable, nutritious food nearby? Can they get to school or work without hours of unreliable transportation? Do they have stable employment with fair wages and benefits? All of these everyday realities directly impact health outcomes.
And it's not just about individual choices, it's also about the structures. Policies, institutions, and systems either expand or limit people's opportunities and access to them. For example, healthcare coverage, access to quality education, racism, ableism, transphobia, or the availability of parks and green spaces are all structural factors that ripple through entire communities.
Right. When we talk about social and structural determinants of health, we're really saying that health is shaped as much by a zip code as by genetic code. If we want to improve health, we have to address these broader conditions that influence whether people can thrive.
And this is why the work happening across our 6 departments is so interconnected. Public health might focus on community level interventions. Nutrition research looks at food environments. Counseling and family science and human development consider mental health, family support, and the context in which we live, work, and play. Communication sciences and disorders helps ensure people can access care effectively, especially as it relates to hearing and speech. Kinesiology looks at movement, prevention, and physical health. Together, they give us a fuller picture of health equity.
And that's why this podcast exists. We wanted to share our research in a way that's not just for other academics, but also accessible for students, professionals, community partners, and the public.
Exactly. We would love for what we share here to be more than just information. Our hope is that you can use these insights in your own life to help strengthen your health and well-being and the well-being of your families and communities.
Each episode will address 3 key questions. What did we find? Why does it matter? And how does it connect to the bigger picture of health equity?
So whether you're a student curious about what your professors are working on, a community partner looking for new insights, or just someone who cares about how research shapes real life, you'll find something here.
And we'd love for you to follow along. Be sure to subscribe to Community Health Briefs and share it with colleagues, classmates, or friends.
This is research you can trust, explained by AI in minutes.
And together, it's another way CCHL is fostering unity and advancing health for all.
Thanks for listening to Community Health Briefs. This podcast was created with the help of AI, verified by the paper's author, and does not necessarily reflect the views of the College for Community Health or Montclair State University. Thanks again for listening, and stay tuned for our next episode. Make sure to subscribe and check us out at www.montclair.edu/CCHL to learn more about us and the amazing work we're doing for community health.